All right, we are back and we have Dr. Abby and Dr. Kumar, AJ Kumar, with us today from UH Conneaut Medical Center. And I didn't flip the camera thing, but okay. We will do that on the break. Anyway, so what are we talking about today?
So we wanted to start by talking about the flu shot, the flu vaccine. There's
Okay.
a lot of questions about that. It's a season for it. So I think Dr. Kumar is going to take it.
Okay. So the flu vaccine, who are the patient should get the flu vaccine? So everyone who is more than 6 months, or we can say up to 2 years of age, who are more than that, they should be getting flu vaccine every year. Flu vaccine timing is from, we usually take from November to March, but this year it's early. So we are giving flu vaccine starting from September. We started already.
So why was it earlier this year?
Earlier this year because it's a WHO, so WHO has labs all over the world, okay? And they have lab and they can monitor the flu virus in the community. And they find that the strain of the virus is more prevalent this year. So they started early.
No, that's not good.
Yeah.
There have been in past years, there have been shortages of serums and stuff, hasn't there, like in past years? Is there any problem this year?
Not that we've heard of. No.
So anybody 2 years or older?
Yes.
6 months or older.
6 months
or older.
Yeah.
Okay, yeah. We're trying to get that 6 month demographic on the show, but they're not watching. So, was it at a time that you had to be, it was like just better if you were older, or is it just there's an emphasis there, or just everybody that's 6 months or older should do it?
The more comorbidities you have, so if you have diabetes, you're a smoker, all that kind of stuff, it's more important. Although everyone over 6 months should get it, it's more important for those people who have underlying disease processes.
Okay.
So as you get older, you have more of those.
Okay. And now I know somebody that got the shot and a couple days later got a mild flu. Is that something that you can get from the shot, or is that just a total coincidence?
Okay.
I'm sorry. I heard people say, well, I heard that you have a better chance of getting a mild case of flu after you have the shot, and I didn't know if that was true or not.
Oh, okay. So I heard this from my patient lots of time. We don't want it because we get sick. Okay. We give you flu vaccine to make you sick. Okay. The whole purpose of giving the flu vaccine is we give the killed virus, not the live virus. Okay. So once we give the killed virus, you get little sick, maybe for 2 or 3 days, fever or some myalgia. But once you get the live virus, you have immune system which developed due to killed virus, and it can attack on the live virus.
Okay.
You can die from the live virus, but from the killed virus, there is no chance of like that. So it's all about developing the immune system so we can fight with the bad people.
Okay, all right. So it's much better to feel not too great for a couple days than to get the real thing and be out for, I don't know, how long can it?
It can be as bad as sending you to the ICU if it gets very, very complicated.
Yeah. I have seen the people die from it. Where I used to practice before, I have seen in the ICU, there are lots of patients who have seen. So once you get older, you have more lung problem because you inhale smoke, secondhand smoking, even if you don't smoke. So if you get the flu at that time, your lung is already weak, and on top of that you have flu virus. Then you can go up to ICU, you can hook up with the ventilator for 10 to 14 days. You can get bad shots and everything.
Yeah.
So it's better to get 2 days of fever rather than going into the ICU.
Okay. Yeah, that makes sense. Now, does everybody feel bad, or is that just a few people? Or?
It's person to person. Not everyone experiences sort of the myalgias. For some people, it's just a little ache in the arm where they got the shot, and that's about it.
Okay. So where do they get the shot?
Usually get it in one of your arms.
Okay,
Yeah.
but I mean, like, you just go to your
So
physician.
you can go to your doctor office.
Uh-huh.
You can go to any pharmacy. There is no prescription needed for that. You can go to any pharmacy and they are available and they are happy to give you vaccine.
Okay.
Yeah.
And you say this is until, what, March?
Yeah, this year it will be March.
Yeah.
Yeah.
But it's smarter to get it now.
Yeah,
Definitely.
it's always
It's
better
flu
to get
season
it now.
Yeah.
Right.
Yeah.
Yeah.
I mean, we live in Northeast Ohio, and everybody
Right.
after a while starts getting the sniffles and
Right.
everything else, so.
And the longer you wait, the more likely you are to get the flu. You know, getting it in March is still good, but it kind of defeats the purpose because
Okay.
it's flu season now.
Okay. All right. So get your shot. You may not feel well for a couple days. You might be fine, but it's a lot better than
Yeah.
the alternative. Is this shot that is given today for that, is it different than the shot? Every year, does it change?
So how it works, WHO has several labs and they monitor the virus in all over the country.
All right.
So they pick the top 3 and the 4, the virus which can kill the people, and they make the vaccine. And this virus change every year. That's why we change the vaccine every
Okay.
year based on the virus.
Sounds a little bit like a science fiction movie.
Yeah.
It kind of is. The virus actually
Yeah.
mutates every year, and we
Yeah.
try to capture as much of it,
Mhm.
as many of the most common strains as we can in the shot.
Okay,
So,
interesting.
Yeah, that's one reason you get it every year. The other reason you get it every year is the immunity really is, it only lasts a year,
Okay,
and then you need it again.
okay.
So
Is it, if you're healthier, does that minimize the chances that you're going to have any distress from the shot, or does that not matter?
that doesn't matter.
It doesn't matter.
Yeah, doesn't make a difference.
Okay. And do you emphasize, I know you're emphasizing everybody, but I like teachers who are around kids and medical workers, I would
Right.
imagine, are pretty much told you better get the shot.
Yeah, we have to get the shot mainly because, you know, if we were to get the flu,
Right.
we would pass it on to our patients and things like that. So, yeah. Anybody who's working around a lot of people, it's more mandatory.
So did you guys get
Yes.
you did?
Yes.
Yeah.
we have to. It's UH policy. So.
Yeah.
No, I mean, but did you guys feel any effects from it?
Oh, no.
No.
No. No.
So it's nothing to be apprehensive about or anything.
No.
No. Yeah. So some of a lot of the time it comes up if you have egg allergies.
Mm.
One of the contraindications.
Oh, that's right, yeah. So you
Yeah.
should tell them if you have an egg allergy.
Yeah, you should let them know. There are versions of the shot that are not made with the egg base and stuff like that. So there are other things that are available. There's basically I get a lot of questions on how many different types of the shot there are. So we have a trivalent shot and we have a quadrivalent shot. So we have both of those. Basically the trivalent covers one type of influenza A, and 2 types of influenza B, and the quadrivalent, which means 4,
Right.
covers 2 types of A and 2 types of B, so it covers one more strain.
Oh, okay.
Yeah.
So who should get what?
Everyone can get the quadrivalent
Yeah.
if they want to cover all 4 strains.
Okay.
And then they also have the intranasal
Yes.
spray.
Now, I understand, like, a lot of places don't do that.
Yeah. Like we don't carry the intranasal. We have the
Yeah, we
injections.
don't have.
So that's better. The injections are better.
Yes.
Okay.
They've been proven to be better.
All right. So why would you get the spray? Because you're afraid of the shot or something? Or
Probably.
Yeah.
That's probably the only reason.
Yeah.
People who don't want to get a shot would rather go with the spray.
Okay.
Yeah.
All right. Interesting. So get those shots, and you can get them at any. Pharmacy
you
or
can
go
get
to
it
your
at your
doctor.
doctor's office. Yeah. Yeah. Very important to get that.
Okay. So what's part B today? Maybe. Well, how about we want to take a break now before we get into something else?
Sure.
And then,
Sounds good.
Okay.
and if you have questions about the shots or anything else we're talking about, we're at 593-7181. We've got Dr. Kumar and Dr. Abby here today, and we were just, if you're just tuning in, and you should be watching the whole show, but if you are just tuning in, the first thing we learned is get that flu shot. No excuses. If you're 6 months old or older, you should be getting the flu shot, and if you're 6 months, less than 6 months, and you're understanding this, I want you as a guest on the show. We were talking off air that you have been here for about 2 months.
Yes.
So can you give us a little background as to how you ended up here and
Yeah,
your
sure.
specialties and all that kind of stuff?
Okay, sure. I did my medical school from India.
Okay.
I came to Louisiana and I did my internal medicine training for 3 years over there, and I graduated in February this year.
Okay.
So I interviewed at various places like in Alabama, West Virginia, and here.
Okay.
And I find this place more better compared to other places. So
Really?
that's why I came here. Yeah. I like the nature, greenery, and everything.
Yeah, see, I have a friend when she was going to high school, she lived in California, but her parents were from Conneaut. So she would come back and spend the summer. They would all spend
Yeah.
the summer with the grandmother. And she said that everything is just greener here.
Exactly. So that's the thing I like here. It's very beautiful. I live in Ashtabula
Okay.
at the harbor, so
Oh, yeah, that's nice. Definitely.
yeah. On the weekend, I just go to the lakeside and enjoy birds and all that. Anyway, so basically, I work with Dr. Abby in the outpatient, and I work in the inpatient as well. I take care of the sick patient who go to ICU, who need ICU,
Okay.
or who go to the medical floor. I cover like COPD, acute attack of COPD, asthma, acute attack, high blood sugar, high blood pressure, its complication,
Mm-hmm.
any heart problem like irregular heart, blood clot, lung clot, various other things. So I take care of all these things.
That's quite an array.
Yes, I take care of all these things. So our training in LSU in Louisiana was like that.
Okay.
Yeah, I spent like 6 months in the ICU, and we were like actually taking care of the patient with only little supervision from my attending. So our training was very intensive.
It sounds like it.
Yeah.
So what do you notice different about patients here versus Louisiana?
Here the patients are more compliant with the medication. What I see, my patient, but in Louisiana, the patient like if you have high blood sugar, they keep on coming to the hospital with its complication because they never took the medication as an outpatient. So they keep coming, they don't take the medication for COPD, asthma, and that's why they keep coming for same problem, for the acute attack. The one thing which I then saw here, but I saw in many people in Louisiana is pancreatitis. I have not seen even a single case in 2 months.
Oh, really?
But there I used to see like every week 3 or 4 patients who came to the hospital.
With a lot more drinkers there?
I don't know.
It is legal to drink in public in Louisiana, in New Orleans.
Yeah.
So,
Yeah, and the other thing, their lifestyle, because the pancreatitis does not caused only by the alcohol.
Right.
It can be from the gallbladder, and the people who are obese, they have more gallstone. They have more lipid abnormality, which can cause the pancreatitis.
Okay. We speak about obesity. Where is more obesity? Here?
No.
No?
It's nothing here.
Really?
It's nothing.
This is a
Believe me.
revelation here.
yeah, because you would think it's here.
Yeah.
Believe me, the average weight I saw the patient over there like 300 to 50 pounds. That was average.
This is Louisiana or West Virginia?
That was
this
in
is
Louisiana.
Okay.
Yeah, like 250, 300. That was average for us.
Well, that's pretty bad too, because the weather there is warmer
Yeah.
You
year
would
round
think
than it is
you'd
here.
go out
Yeah.
and exercise, right?
Yeah, lifestyle, eating habit. It's not good over there. They usually eat more
Right.
junk food. They don't take care of themselves. That's why.
Wow.
I saw like 900 pound as well. You won't believe me. 900 pound.
He couldn't walk.
He couldn't walk. He needed too bad. So anyway, so these are the things I have seen, and so I can manage pretty much these common type of things.
So you're talking about inpatient and outpatient. So inpatient is when you're talking about when they come in and you're doing the COPD and
Yes.
that sort of stuff. Outpatient is they're
that's what we do.
they're not going to be admitted to the hospital. Is that
Outpatient
Essentially.
is just going to your regular doctor for regular appointment every 3 months or 6 months.
okay?
So what I like, I see the patient in the hospital, okay, and let's say patient does not have any doctor, regular doctor. So I call them up to me, so I know everything about the patient. So I call them every 6 months, 3 months, or 1 year, whatever their time, whatever they require, and they can follow up with me. So
Okay.
that's an outpatient.
So this is
Not
if they
in
don't
the
have if
hospital.
they don't have a doctor.
They don't have a doctor, or they are looking for their doctor, or they have a doctor but that doctor retired,
All right.
so they can come to me. Yeah.
Is there, Dr. Abbott, you may know better because you've been here longer. Is there sufficient doctors here now? I know for a while there was a problem getting a family physician.
Right. So recruitment has really picked up.
Yeah.
So since I've started, we now have a new gastroenterologist here who I believe has been on this
Yes,
show.
right.
Dr. Perry Waller.
Mm-hmm.
We are trying to recruit another general surgeon. We are trying to recruit family practice. We're trying to recruit OBGYN. So we're trying so that we family practice so we get some pediatric coverage as well. But yeah, recruitment's actually on the uprise. So I see things going in the positive direction from here.
I know at one time I'd hear physicians, they don't want to be in the area, they want to Shaker Heights or something like that. And is that still a problem, or are
Well,
they?
I live in Mentor.
Okay.
So that's why I'm mostly outpatient
Uh-huh.
medicine, because my hours are fixed that way. They're 9 to 5.
But Mentor isn't too bad.
It's not too bad. And probably the reason for that is a lot of the physicians that come in, they're coming in from residency either at Metro or UH main campus or Cleveland Clinic.
Right.
So they still have ties, either family or friends or whatever, to the Cleveland area. So they
Or
like
they're
to-
working there and coming here.
Right, right. So that
So-
can happen too. So, yeah, I would say that still happens. I don't think that changes the quality of care or
No,
anything like that. But yeah,
What I don't know if it's the gastro person that lives in one lives in Shaker Heights, and I got him. If I needed to have my iPad fixed or something, they got an Apple store there. He said, yeah, he would take it for me.
yeah, it might be him.
Okay, so also, did we cover that all pretty much? Or-
Yeah,
Okay.
we did.
All right. And you're talking about an urgent care center opening.
Yes.
So
So-
that's at the hospital?
It is going to be at the hospital. It's going to be right near the emergency department. It's going to be opening in the next few weeks is what we're anticipating. This is basically so that, because me and Dr. Kumar, we work Monday through Friday in the outpatient setting, and then the clinic is closed. So a lot of Conneaut residents don't have anyone to go to if, they have the sniffles or they have something that doesn't really require an emergency room visit, but at the same time, they do need to see the doctor. So that's what that's
Okay.
going to be open for. It should be open Saturday through Wednesday. So I think it's going to be best utilized on Saturday and Sunday
Right.
since we're not here. UH does have one in Ashtabula as well, but for
The
some
one on
people,
Lake Avenue?
right. But for some people, that's still a drive. So we're thinking if we've got one right here, right in the
Right.
hospital, it'd be very convenient for those of us who live here.
So this would be something if you get something maybe over the weekend or
Right.
you don't have a doctor that you would normally go to a doctor for
Right.
versus
Going to the emergency room.
right, like
Right.
slamming your foot in a door or something, you have a
Right.
broken foot, you need to go to the emergency room for
Right.
that.
Right.
But emergency care may be for you've got a cold you can't get rid of
Right.
or
Right.
something like that.
Right. So actually slamming your foot in the door too, but you can go to the urgent care.
So when you go to one of them and say, this is what I did, where should I go?
That is actually something that we're contemplating. Can we help the patient sort of make that decision? But usually anything that you think you're not going to have to be admitted for, you're not violently ill, you can go over to the urgent care.
Okay. And if necessary, they'll send you back.
Yeah, it's not even back. It's connected to the emergency room, so you go right through to the emergency room if needed.
Okay, so I'm picturing the emergency room now going in the back,
Yeah.
right? So where is the emergency care from there?
So there's there's a door in the emergency room that opens up into, I want to say, it's like a bigger room.
Okay.
It's like a bigger room that has two patient care rooms in it. So that's going to be there's going to be registration, and then there's going to be two.
So it's going to be easy to find.
It's going to be
'Cause,
easy to
yeah.
find. We'll have, signs and things up for...
Flashing lights.
Because it really is a big need for our
Oh,
community.
I bet.
I do get phone calls on Saturday and Sunday, and yes, if it's a matter of just putting in a prescription, that's not a problem. But if I need to see the patient and I'm not physically there, this would be very helpful. So
Can you use Skype?
No.
Oh, no.
no, unfortunately not.
But you do hear about like these
Online
services,
doctors,
online
yeah.
doctors that you can buy a subscription or
Right.
whatever, and that's a sham.
Well, online medicine is becoming a little bit of a fad. I don't know if it's going to pass or not. The only thing is, for anyone who went to medical school, it's not the same as seeing and
I
touching
wouldn't
a
think
patient.
so.
Yeah.
If you're on a
Can't possibly do
computer,
a physical
you're-
exam.
yeah, cough for me.
Right. Not
I
even
mean,
that, but you can't listen to lung sounds or heart
Right.
sounds.
That's
or
the first thing
anything.
a doctor does.
Right.
Yeah.
So, right.
So
Right. As medicine becomes more advanced, I mean, you tend to lose things. So you have to find a delicate balance where you're making use of that technology, but you're also maintaining that patient contact. And
does the internet mean you have a lot more patients that have already evaluated and decided what they had?
This has been a long-standing problem, actually, probably since the internet came out. I know patients like to, look up and hypothesize on what they think they may have.
I bet.
The internet can embellish a little bit. You have to be very careful which websites you're on. Like, you can't just Google it up and just go into any old website. When we use the internet to help us treat, we're using something that is medically validated,
Right.
based on research articles and things like that. For my patients who want to read about something that, I tell them you have such and such an illness and they want to know more, what I do is I go on my medically validated website and there's something that says for the patient or patient instructions, and I'll print it out so that it's in layman's terms and they can understand
Okay,
it better.
excellent.
So I would advise that if you just want more information on something, ask your doctor and they'll get it from the right source so that you're not just Googling up what people
Right, and there's always something on the news
Right.
feeds that there's new studies saying this or that,
Right.
and they may be disproven the next day.
That's the
and-
thing. So anything that is in a textbook, which is what we study, means that it's not based on one study. It's
Right.
based on a multitude of studies, and the data is very, very significant. There'll always be one study that says something about something, but that doesn't mean it gets validated and put into a textbook.
Or people will see something they like in a
Right.
report and decide, well, this has got to be true because this is what I think. Or,
Right.
or the person that reads something and all of a sudden they've got the disease.
Right. Right. And
I used to work with a guy, and it was when Lyme disease was a big thing. And
Right.
he read something about it. The next day he called in sick, said he had. I think I have Lyme disease.
Jeez. We all do that. I do that too. Like, maybe that's what I have. But yeah.
Okay, excellent. So you work exclusively in Conneaut?
Yes. Only in UH and the clinic with Dr. Abby.
Okay.
Which is still UH.
Right,
UH.
right.
Yeah, same, yeah.
So they decide to open this because of the need, but also the fact that they all of a sudden they had people to staff it. So you're not going to be there on Saturday and Sunday, though, right?
No, it's not us. There will be other staff there. But yeah, it's basically because we're not there that they're implementing this.
Okay.
Yeah.
And there's always an emergency room physician, isn't there, at the hospital?
Yeah. 24/7.
Yeah. I had problems with my parents, especially my mother, and she was going in for whatever before she died. And the emergency room physician there was really good, and he would set us aside and talk to us about, reality. Because I don't know, sometimes when it's your parents and stuff, you think, well, this time when she gets out, it's going to be better.
Right. You're
And they were real good. They had just all the physicians that when they needed to talk to us, they found a room and they spent the time that we needed, and I just kind of remember that.
Yeah. Yeah. So The emergency room's still open, so
Yeah.
you know, if that's where you need to be, then that's where you need to
Right, absolutely.
be. Yeah.
So, but now there's a little bit more choice there.
Right.
Or when is it opening?
Tentatively December 1st.
Okay.
Yes.
All right, excellent. All right, Dr. Kumar and Dr. Abby, thank you for being here. Get that shot. They got it, so you need to get the shot too.
Yeah.
If you're 6 months old or older.
Yeah.
All right, thank you very much.
All right.